All right, this video is a follow-up to the rabbitry abscess treatment video that I did almost 3 years ago. And you can watch that here as I want you to finish this one, or if you want to go back and watch that one and come back to this one, that's totally fine. I do go through the actual treatment process of one, so hopefully you never have to deal with it, but that one shows you the step-by-step of what I do. But this video is going through some of the questions that people have asked underneath that video, just to kind of help, clarify some things that questions people came up with, stuff like that. So it's really difficult to, show unique situations when it comes to treating an animal because, it didn't happen, and I'm not going to make something happen to an animal to be able to show it to you. That would be bad. But obviously, all the disclaimers, I am not a veterinarian. I don't claim to be. This is just what I have done in my personal experience. So obviously, do so at your own risk. There are risks to everything. So kids, don't try this at home type situation. So I'm just going to jump into the questions, and I'm going to have to read them. So bear with me here. But the first question is, how many times have you done this? So I have raised rabbits. Honestly, I had my first herd of rabbits at the age of 10, which was Jersey Woolies. And so I got from then to my mid to late teens. Then I switched to French Laps at 17, and I've had them ever since. So I really didn't have any abscess issues until I got these big guys. And so I'm 32 now, so you can do the math on that one. But I've had rabbits in general for over 20 years. And so really just during my French Lap season, I've probably done maybe 10 abscesses altogether, all in different situations, and with varying degrees of success. There was only one time where I was not able to get to the abscess in time, and that was because it was literally on his jaw, and if you've not tried to open a rabbit's mouth, it's virtually impossible. So that one, and he just went quick. So, but other than that, every other one I've been able to treat, no issues. So there's that. Okay, this next one is multiple questions in their one comment. So the first question is, can you replace lavender oil with any other oil? So essentially, yes. The main thing that is the clarifier of that, you want something that is that minimally antibacterial, which is lavender oil. It's not technically an antibiotic, but if you have something that can be an antibiotic, if you want that, an antimicrobial, something like that. The idea is you want something to eat the infection. You want it to kick it out, and that is just the one that I tend to use, mostly because it's the most affordable for most people, most widely accessible. And the other thing that I want to clarify is that if you are wanting to change it to something, I had someone else ask about another type of oil that I've never heard of that I had to Google. It's like another country type situation. You want it to be able to dry out or not cause a covering over the wound. So I'll get to this question later, but someone asks about using the antibacterial or an antibiotic cream. The reason I don't do that is because it's sticky. It puts this thick coating over it, and rabbits have straw, they have food, they're around dirt. You're honestly basically rubbing dirt in the wound kind of situation. So that's why I use the essential oils, because it's called oil, but it's the consistency of water almost, to where it dries very quickly, but it still has the medicinal purposes. So that's the clarifying things there. If you change the type, it's fine, but make sure that it'll clean out the infection and help get rid of it, essentially. And then make sure that it doesn't cover over the wound or hold dirt and bacteria in it. Okay? All right. In the next question, or part of her question, which I'm wondering if she worded it a little bit differently, but I'm going to just clarify it anyways, just in case. Can we stop the bleeding using a bandage or any other infection? And so I think what she's meaning is to help prevent infection. The problem with animals is they don't leave anything alone, right? That's why dogs go home with the collars. So you're not going to leave that on a rabbit either. So again, that's why I go back to keeping it dry, let the wound open and heal from the inside out. And it's just not going to work to put a bandage on a rabbit, especially depending on where it's at. So, and I also would think that it's very risky to put bandage type material on the rabbit, because if they chew it and digest it, that's a whole nother mess. So I just wouldn't. And then, are there any other dangers during this process? Well, yeah, I mean, there always are. So you have to decide, is it worth it to you to try it, or is it worth it to you to just go pay a vet to do it? Those are your choices. So I don't mean to be like hard on it, but that's the facts of reality. And so I don't sugarcoat things. And honestly, it helps you decide when you look at it, like, these are my choices. Which one am I going to pick? If you are looking for a step-by-step guide that you can have next to you while you are trying to treat your rabbit's abscess from home, this guide is for you. There's an exact step-by-step process that I follow, as well as a list of tools that I use to help me and the rabbit have the best success, for them to get over the abscess, as well as for me to treat it quickly. There is also some common questions and photos to help you know what you're looking at, as well as just some common questions that people tend to have when they do that. I in no way claim to be a veterinarian, but this is just what I have had success with in my 20 plus years of raising rabbits. Grab the guide in the description below. Okay, here's the next one that's really good. What about an abscess that has already burst but is not clearing up? Can I squeeze the pus out and drop lavender into the hole? Yes, I had this situation happen, which was like, it's a blessing. It doesn't always work out that way, so don't assume you can leave it without having to clean it out yourself. It's so much easier when it does burst on its own, but what happens is you can usually get the largest chunk out that way, and it's the easiest. It's because the body's naturally trying to push it out anyways. But if it doesn't, you're going to have to get it out, or you risk leaving the infection in there. Yes, it's just like a pimple. Really, just think of an abscess as a big old pimple. You want to get as much junk out of there as possible, and the lavender oil really gets in there into the areas that you can't get to. And it also will help, hopefully, pull more of it out. All right, this next one is, if the lump is the lump squishy or hard? My rabbit has a similar kind of lump in his, she says hand, but I'm going to say paw. Sorry, they're not humans. In the paw, so we're going with the front one. It's been almost 3 months, and I noticed a lump in his paw. So this is very common, and what people sometimes miss is that rabbits have a dew claw, and they can start to curve a little bit and poke the bottom of the foot. And so in that instance, it's going to feel a little bit harder. I recently had to deal with this with a girl that she's very heavy, and she's getting older, and that happened. And so with a harder situation like that, the way you can tell that if it's an abscess or not, even if it's harder, is you're going to be able to, see if I can use my arm. You're going to be able to pinch the abscess to the surface underneath the skin right here. So you're going to be able to do that. And if you can almost get your fingers underneath it, underneath where the lump or the infection is, then you know it's an abscess and not a bone, or, if it's something like like a tumor type thing, that is far beyond me. But an abscess, essentially, it's almost like a pearl, like an oyster type situation. So if you got something in there or the infection, it's like a little loose ball that you're going to be able to remove. Okay? All right, this question is, do you give antibiotics? My rabbit has the same problem, again, for the second time. So here's the problem with internal antibiotics. They're not going to get rid of it. It's an infection that needs removed. I've had a little bit of it on hand, and I have given it as just a bonus kind of situation. The only reason I will do it is if I think it's going to take me a little bit longer, or it's a harder one that's just it's not coming out as easy. That gives the animal something else to help keep its immune system going. So give it a try if you want to, but it's not a fallback, and it's definitely not going to be I can get out of cleaning out the infection by giving them an internal antibiotic. It doesn't work. I'll try that. All right, here's this next question. Does this remove the abscess for good? Are you just removing the pus, or are you taking out tissue as well? I do my very best, no tissue, because you don't want to cause any actual damage. You shouldn't have to. That's where this comes with experience, is you're able to tell more what is tissue and what's not. Usually I have to go back in at least a second time to make sure that all the infection has come out. Ideally, I want to see the wound or the opening heal over with a red scab. If it is a colored or creamy type scab, it's very likely that there's still some infection surfacing. But the bonus of this is that once you've already made the incision or it's already popped, then it's already got some direction that it needs to go. Does that make sense? So oftentimes I'll do day 1, clean out as much as I can for as long as the animal will tolerate. And so then I will slather a bunch of lavender oil on the wound, give them a day, come back and check it over again the next day. Oftentimes I gotta peck off the scab and clean out a little bit more, but usually it's 2 to 3 times within 24 hours apart. They usually start to heal over. Now, here's an instance, back to the one with the foot. That is on a spot where they're still putting weight on it. So obviously it doesn't feel great, but it's still getting more irritated. And so that is also an area where if the skin is swollen and infected and you kind of don't think that there's anything left and you're not getting anything, go ahead and wait for 2 or 3 days and see if the infection and the swelling goes down into where you don't have a lump anymore. Does that make sense? So like with my recent experience with it, I was pretty sure I got everything out, but I wasn't sure. And it really, I was getting a red scab, like it didn't look, but the foot was still swollen a little bit. And so I just decided, well, keep putting medicine on it, but wait to aggravate it again to see if there was any infection. I gave her about 3 to 4 days. And with each day, the swelling went down and her foot went back to feeling normal. All right, so the last question is, so you don't have to stitch it up? No, you don't. And like I had mentioned before, the main thing is we do want it to stay open air and heal. Now, most openings, this is like the size of a quarter. That is the biggest I have ever had, and that was the one that it popped on its own. Most of the time, I can get everything cleaned out with something like that, so it might be about a dime. The thing with this is that it's less painful for them if you just get in there, make the opening, and open it, okay? Instead of, it's like trying to push a small pimple through a hole that when it hasn't burst yet, it hurts more. So it's like causing pressure, that you're trying to just push through something that it's tearing the skin essentially. So it's a lot less painful, a lot less stressful for them if you just make an opening and get it done. Okay. All right. I hope this was helpful for you. If you come up with any other questions, go back and watch the process video of it if you want to do that, or drop your questions below and I will be happy to answer them.